Hello friends, today I'm just down memory lane and I just thought of putting my thoughts for a number of interesting cases, very interesting people that we come across as doctors. When a patient comes to us, there is an entire gamut of emotions that a person carries, especially with something like cancer. As a doctor, you try to be neutral, but after all, doctors are human beings. I thought, why not recount some of this? Because these are amazing human stories. The interaction between doctor and patient is often one-sided. There's a lot of give and take that happens. People do get affected on both sides. As professionals, we try to be neutral. We try to keep ourselves away from those emotions. But a lot of times we get sucked in. And this is a time when I had just started practice. And this was one person who had come to me from all the way from Hubli. She was an elderly lady. No, she had breast cancer, and somehow she said, and surprisingly for a young surgeon like me, I was hardly 1 year into practice. I always felt that these patients who come from outside, who are very well affording, who come from a very educated background, why should they choose a surgeon like who's just started practice when they can go to the best in the business? But somehow she met me and she said, "Ki beta, I think you are my son, and I will get operated only from you." And for a young surgeon like me, it really struck me, and it was something that became very emotional. I operated her. She, in spite of being from a faraway place, she continued to follow up with me. And I think now she must be around 85 years old. And yet, she calls me up every year. She remembers the names of my children. I had only one son then, now I have two. But she remembers both their names. She remembers what they are doing. She remembers what my wife's profession is. She continues to congratulate me on whatever I have done. She follows me through. And she treats me like a true son. And that sometimes, really sticks on. I mean, you feel that these kind of rewards are really much bigger than monetary, much bigger than the respect you get professionally. And they really make your life worthwhile as a person. And I think this is what doctors live for.